My name is Marissa Pedersen. This is my husband, Derek. We have Kieran, who's 2.5 years old. Kieran has moderate to moderately severe hearing loss. He uses hearing aids for that, and he has kid syndrome, so that contributes to the deafness part of that. With his condition, his hearing level should stay stable over time. So far, they stayed the same since he was born. We were very confused what to do when he got diagnosed with hearing loss, especially since it doesn't run in our family. So having a resource to go to during these times, especially the early stages, has been really invaluable. We chose Family Conversations because we thought the verbal aspect was really important, especially since he has access to sound and with his hearing aids as well. We also thought sign was important because when he has his hearing aids off, we recognize that he can't hear as well. And we do a lot of outdoor activities, like a lot of skiing. So there's times where he's going to be farther away or it's harder to hear, or just with the wind outside, where sign is really valuable. And we've already seen that just with bath time. When he needs to take a bath and he doesn't have his ears in, he can understand us a lot better with his sign. It's been really incredible because it felt a little helpless when he first got diagnosed and we didn't know what to do. I wasn't sure how everything worked, how hearing aids worked, if he'd have access to sound, how much that would be. And so to see now him almost 3 years old, signing, being verbal, is pretty incredible.
You saw a horse?
Wow.
A frog.
Meow.
And a kitty cat?
When he started connecting signs together, that for me felt good, because it was like, okay, he's actually able to communicate through this. He's actually able to ask for please share for the first time. Yeah.
Hey. We're lucky to have a really good communication coach who's helped us from the beginning. Helps us with any struggles that we have, our frustrations, just letting us know it's normal. We'll get past it and working on ways to improve that. Having the support is probably the favorite part, because it's not only the monthly visits, but it's she's called sometimes. She can email, can email her at any time. So if there's a quick question to say, but even having a cheerleader too, there's times I've emailed her oh, Kieran did this today, or signed this, or said this, or sent her a little video. So having someone else in our corner is really beneficial.
Hi, I'm Shyla Gack. I am a communication coach with Family Conversations Northwest School for Deaf and Hard of Hearing Children. So the boys, Kieran is the kiddo I work with, but he has an older brother, and they like songs. We practice songs and signing, when we're doing that, Kieran will look around the room, because we'll be sitting in a circle, and he'll look around the room to make sure everyone's participating, signing, gesturing, or singing. And then he gets this huge smile on his face.
We do a lot through song, so Itsy Bitsy Spider, Old MacDonald songs, so it's kind of catchier for him and he wants to listen. And then it's fun when I do the sign over and over and then suddenly he starts repeating it when I wasn't sure if he was understanding it.
Bubbles, yeah. You saw Bubbles? Bubbles.
Mom sent me a video, which is adorable, and it's the boys, both boys, singing the Bubble song. Singing and signing. Hi, Kieran. And I thought that was pretty cool, that it's just this whole family thing that they do together.
Bubbles, bubbles, pop, pop, pop. Pop, pop, pop. Bubbles, bubbles, bubbles.
I've joined several parenting groups for those of hard of hearing children, and seeing the kids are through high school, the things they're doing through on the swim team, a cheerleader, into college, getting careers and all that. So knowing, because again, in the beginning it did feel kind of oh my gosh, how do we navigate this? But knowing that he can do whatever he wants really, and knowing that he has that support from us.
Just like every parent, hope that he is able to follow his passions, whatever they turn out to be.
It is overwhelming in the beginning, and that's okay. There is support out there, whether it's like we go to Children's Hospital, audiology, ENT, with this Family Conversations program, like we have so much support. And just talking to others too, like we talked to our parents about his situation, we talked to his daycare provider about his situation, to try to let everyone know how his hearing aids work. Like they all learned how to use his hearing aids. We printed out signs for some like the more common signs to help them with that. So just asking for help. Like he has different hearing levels, like we all have different things about us. He's doing normal things. He's acting like a normal 2.5-year-old. Like it gets.
What are you doing, Kiwi?
It's obviously, there's challenges still, but I would say overall things get easier. Things get a little more stable.
It's a big journey. The birth to 3 providers are really just trying to help them follow the family's lead. They're their child's best advocate, best supporter. They're going to be okay.